What types of people should you communicate with professionally? A. Supervisors. B. Administration. C. Clients. D. All of the above. Which of the following factors should be included in the session notes while conducting a session? A. The client's responding was reflective of most sessions. B. The client only slept for a few hours and is yawning often. C. The client is on the same medication as typical. D. The client's routine was the same as most days. What should you include in your session notes? A. Data on behavioral excesses. B. Description of new protocols implemented. C. Client's performance on a skill acquisition program. D. All of the above. A token economy is what? A. Money. B. Controlled reinforcers. C. Freebies. D. A system of generalized conditioned reinforcers. This indicates the availability of reinforcement. A. Spelta. B. VR3. C. SD. D. SR. Which of the following is part of the RBT ethical code? A. Be compassionate for the less fortunate. B. Be truthful and honest. C. Resolve all issues formally. D. If there is an issue, file a formal complaint immediately. Is the most commonly used graph in ABA? A. Line graph. B. Cumulative graph. C. Pie graph. D. Bar graph. Adding anything to a person's environment that will inspire them to repeat the goal behavior. Is this any kind of reinforcement? A. Discontinuous. B. Positive. C. Negative. D. Continuous. In the absence of any prompts or reinforcers, a therapist gives a client an instruction and notes the learner's replies. What exactly is the therapist doing? A. Treatment. B. Baseline. C. Preference assessment. D. Functional behavior assessment. What component of a behavior intervention plan defines which behaviors the client should be taught? A. Problem behaviors. B. Consequence modifications. C. Crisis plan. D. Replacement behaviors. Which of the following may represent an approximate client request for a toy? A. The student makes a T sound. B. The student says, I need to go to the bathroom. C. The student grabs the toy off the shelf. D. None of the above. Maria has spent the entire day hiking in the desert and is in desperate need of a glass of water. She looks for a way to get to water. Hiking in the desert increases the reinforcing value of water, which is known as A. Extinction. B. Abolishing operation. C. Satiation. D. Establishing operation. What is a multiple relationship? A. Working with two clients at the same time. B. Working with two different clients. C. Having two different relationships with one client. D. Working with a client in the community and clinic settings. A client gives you a bottle opener from their birthday party. What does the ethical code say you should do? A. Refuse the gift and send a letter home that forbids future gifting. B. Accept and use in front of them to make them feel good. C. Politely decline and explain to them their parents the nature of your professional relationship. D. Throw it away immediately. What should you do if you are arrested for a minor marijuana charge? A. Report to BACB within 24 hours. B. Do not report. This is not a fireable offense and your credential will remain intact. C. Provide 2 weeks' notice to employer. D. Report to BACB within 30 days. Which is considered confidential information per the BACB ethical code? A. Information about a client that can be found online. B. Information about the people that RBT works with. C. Written records. D. All of the above. If you are not providing direct ABA services and are having a fun Friday, what should you do? A. Do not make reference to, display, or otherwise use your RBT. B. Explain to parents that ABA was being performed under their RBT credential. C. Display your RBT certificate when requested. D. Bill since you have the RBT credential. Your supervisor requests that you work with a new client who has behaviors you have never encountered. What should you do? A. Refuse as you lack experience in this type of behavior. B. Request more training from supervising BCBA. C. Accept since you are contractually obligated. D. Politely decline. Which antecedent increases or decreases the value of a consequence? A. Abolishing operation. B. Establishing operation. C. Motivating operation. D. SD. You are recording the time it takes from the presentation of the demand to the first instance of behavior. What are you measuring? A. Frequency. B. Duration. C. Latency. D. Interresponse time. How long the behavior occurs refers to what measurement dimension? A. Duration. B. Momentary time sampling. C. Latency. D. Tally count. John is recording data on aggression by counting the number of scratches left on his body after a session. What kind of measurement is this? A. Duration. B. Time sampling. C. Continuous measurement. D. Permanent product. Escape, attention, tangible, sensory. A. Functions of behavior. B. Teaching strategies. C. Types of prompts. D. Dimensions of ABA. Determined by ABC data. A. Prompt level. B. Duration. C. Function. D. Interresponse time. The breakdown of a task into its individual components and steps. A. Discrete trial. B. Forward chaining. C. Stimulus control. D. Task analysis. Examples are food, water, sex, sleep. A. Secondary reinforcement. B. Primary reinforcement. C. SD. D. Consequence of behavior. Examples are money and tokens. A. Primary reinforcement. B. Conditioned reinforcer. C. Economic reinforcement. D. Fiscal considerations. Increases the future likelihood of behavior. A. Punishment. B. Motivation. C. Rewards. D. Reinforcement. Adding a stimulus which increases the future likelihood of behavior. A. Positive reinforcement. B. Positive punishment. C. Negative reinforcement. D. Negative punishment. Verbal behavior with point-to-point correspondence. A. Manned. B. Tact. C. Intraverbal. D. Echoic. Removing a stimulus which decreases the future likelihood of behavior. A. Positive reinforcement. B. Positive punishment. C. Negative reinforcement. D. Negative punishment. Reinforcement is delivered on the average of every 2 minutes in which the behaviors occur. A. Phi2. B. FR2. C. 6-2. D. VR2. What are the 4 functions of behavior? A. Toys, edibles, praise, and aversion. B. Sensory, escape, attention, and tangibles. C. Sensory overload, noncompliance, aggression, and compliance. D. Automatic sensory, automatic positive, and social negative. Verbal behavior of requesting. A. Manned. B. Tact. C. Echoic. D. Intraverbal. Removing a stimulus which decreases the future likelihood of behavior. A. Positive reinforcement. B. Positive punishment. C. Positive punishment. D. Negative punishment. What occurs before the behavior? A. Antecedent. B. Response. C. Behavior. D. Consequence. Start with most intrusive prompt. A. Forward chaining. B. Backwards chaining. C. Most to least prompting. D. Least to most prompting. Reinforcing gradual changes in behavior. A. Chaining. B. Shaping. C. Prompting. D. Reinforcing. Teaching a task analysis by teaching the first step first. A. Forward chaining. B. Prompting. C. Backwards chaining. D. Fading. Start with least intrusive prompt. A. Forward chaining. B. Backwards chaining. C. Least to most prompting. D. Most to least prompting. Teaching the entire task analysis at once. A. Total task presentation. B. Single task presentation. C. Discriminative stimulus. D. Forward chaining. You provide reinforcement to your client for clapping and ignore him when he hits. A. Differential reinforcement of alternative behavior. B. Differential reinforcement of incompatible behavior. C. Differential reinforcement for lower rates of behavior. D. Differential reinforcement of other behavior. Reinforcing progressively lower response rates. A. Differential reinforcement of higher rates of behavior. B. Differential reinforcement of lower rates of behavior. C. Differential reinforcement of other behavior. D. Differential reinforcement of alternative behavior. Reinforcing progressively increasing rates of behavior. A. Differential reinforcement of incompatible behavior. B. Differential reinforcement of other behavior. C. Differential reinforcement of alternative behavior. D. Differential reinforcement of higher rates of behavior. Teaching communication to replace problem behaviors. A. Functional communication training. B. FIT. C. Differential reinforcement of other behaviors. D. FR3 schedule of reinforcement. What occurs when reinforcement of a previously reinforced behavior is no longer provided, resulting in the decrease of frequency of the behavior in the future? A. Endangerment. B. Extinction. C. Pivotal response training. D. Negative reinforcement. Which type of extinction procedure has the individual simply giving no outward signs or response to a behavior, such as eye contact, verbal physical responses? A. Planned ignoring. B. Escape extinction. C. Functional communication training. D. Positive reinforcement. A child is taught to raise their hand as an alternative to yelling out in class. Which type of differential reinforcement does this example represent? A. Differential reinforcement of incompatible behaviors. B. Differential reinforcement of lower rates of behavior. C. Differential reinforcement of alternative behaviors. D. Differential reinforcement of other behaviors. Adding something that will motivate a person to increase the likelihood that they will engage in the target behavior again. What type of reinforcement is this? A. Positive. B. Negative. C. Continuous. D. Discontinuous. What should you do if you are arrested for a minor marijuana charge? A. Report to BACB within 24 hours. B. Do not report, this is not a fireable offense and your credential would remain intact. C. Provide 2 weeks' notice to employer. D. Report to BACB within 30 days.